This program is sponsored by
Lanka Hospitals. Caring, curing.
Hello everybody, welcome to MEDILINE. You're with us at Art Television. We always delve into common medical problems, specialty medical problems, and we go into these details with, of course, the wonderful support of Lanka Hospitals, one of Sri Lanka's most premier healthcare facilities, where you get the best of technology and the best of specials. When we talk about the best of specialists today, I have with me a very special lady who has over 18 years of experience. Started off in the United Kingdom, where she has practiced in many different fields. She's also not just specifically a medical doctor and a consultant. She goes beyond that because she talks about empowering women with the knowledge, and I believe that is wealth in itself. So let's warmly welcome Dr. Roshan Zeirideen Zaid. Doctor, thank you for being with us. Doctor, of course, is a consultant obstetrician and gynecologist for Lanka Hospitals in Sri Lanka. She's been here for a short while in Sri Lanka, but she's performed fantastic work overseas. And as you would know, the line of patients that wait to see her every day are rather big. So, Doctor, today's subject that we will be touching on, as you have told us about, is fibroids. This seems to be a very prevalent issue with women today. I think it also is something that really alarms them, stresses them out. So let's go to the basics first. What is a fibroid? What are the kinds of fibroids? The sizes? Where are they located? And mostly, how do these actually come up in women? If you could explain that to us, Doctor.
Yes, Joanna. So fibroids, as you say, a lot of women know the word. So they all know fibroids, but they really don't know what they are or what we should do about them, or what does it really cause. So if you take fibroids, as the name says, it's fiber. So it's more fiber and muscle. So muscle and fiber gets together and forms a lump. So this lump, imagine that you have a rubber ball. It's like a solid, thick rubber ball. So the rubber balls are rubber balls. They are benign. So they are non-cancerous little masses, or big masses for that matter, that are in and around the uterus. So imagine if this is my womb, the fibroids can be either on the surface of the womb like buttons on top, or you can have them hanging inside the cavity, or most commonly they are within the muscles. So they can be anywhere. So everything that we talk about today depends on how big they are. They can be as small as a sesame seed, or they can be as small as just a grain of rice, or they can get bigger to a pea size, a grape size, an orange size, apple size, even up to a melon, a huge melon size. So you can have all these ranges of sizes of fibroids. At the same time, how many are there? So if I talk about grapes and oranges, if there are too many on the womb, normally the womb of a woman will be the size of a pear or a small size of a fist. If all these are coming into the womb, depending on the various sizes they can be, you can imagine there will be lots of other issues because of that. So the number of the fibroids is important, where they are is more important. So they are more in and around and on the uterus, and also sometimes, very rarely, they can come outside the womb as well. In and around can be the body of the womb or the neck of the womb, as we call as cervix. So it can be anywhere. And how big they are makes a bigger difference. So it can be 5 or 10 of them, can be the small grape size or the pea size, might not do anything to you. But you have one melon size, might do the whole works. So it can be anything. So as you said, the fibroids can give rise to symptoms, might not give rise to symptoms, and they can be as they are, like I explained to you. At the same time, the common thing that women always come and ask is, why me, doctor? Why should I have a fibroid? Nobody else in my family has it. So all women don't have fibroids. So if you take, let's say, in about a big huge crowd, if I take 100 women and I scan all of them, there will be about 30 to 40% or 30 to 40 women who might have some sort of a fibroid. Either it can be a tiny one, most probably a non-symptomatic small fibroid we might find. Out of the 40, maybe only half of them will have some sort of a symptom or a sign that they will say, because of fibroids I am having this. And at the same time, there's no one reason why a woman will have and why a lot of people will not have. So if you understand why somebody could have, there's no one reason. There's no one genetic reason or one specific reason to say this is why you have a fibroid. But there are certain things we know about fibroid. One, if someone in your family, immediately your mommy, your sisters, your grandma, somebody had a fibroid, there's a tendency that somebody else can have it. So it can run in the family, not necessarily always, but it can run in the family. Number two, they are very, very hormone sensitive. So if there is an incidence where a woman's estrogen or some hormone goes up in the body, like you're pregnant, like you're obese, you have loads of hormones in your body, then they tend to grow because they kind of feed on the hormones. Hence they can get bigger. At the same time, it's found on more obese women because they have higher estrogen and things like that. They are found in women who don't have babies. That is also a fact. And also it depends on where you come and what's your background. Specifically, it's ethnicity. So if I look at women from African countries, out of 100 same women I just told you, 80% or 90% will have fibroids, and they'll be more bigger, more symptomatic women. You come to our side of the world, the Asian women, yes, we might have, like I said, 30 or 40%. You move on to Mediterranean or Caucasian, they might even have lesser numbers. So it depends on the ethnic origin as well. So fibroids are basically lumps or groups of lumps of muscle and fiber tissue which can vary in sizes, which can and cannot sometimes cause symptoms, but they are found in women alone. There are no fibroids in men. So obviously it's specifically unique for women, found in and around the uterus.
Right. Doctor, I have a quick question here. The second thing I go into is, obviously all women have menstrual cycles. This is something we go to. Now, period pains are also sometimes questioned, especially bringing into light that today every individual out there is a medical doctor because they have WebMD and so many things to go on to. But clearly the information is not always precise and correct. When it comes to period pain and when it comes to your period, how do fibroids actually collide with that? How do you kind of figure out, okay, maybe I might be having a fibroid? What are the symptoms that we can look into?
So fibroids affect women in many ways. So one of the things that most important is the periods. So they can directly affect your periods. So if you take your, if you think about the fibroid, so imagine that's your uterus, as I said. If there is a big chunk, or even a little for that matter, a tiny fibroid of 2 to 3 centimeters hanging inside your cavity, or it's jutting into your cavity, that kinds of increases your surface area of bleeding. So your amount of bleeding, as you indicated, either a pain or the heaviness, will be more in these women. They might have their same regular cycles as they would have, but the pain will be more because the womb will always think there's something hanging, I need to push it out. So your cyclical pain will be much more. Suddenly, sometimes most of the women say, doctor, all these years I've been very fine, or suddenly these last 2-3 years my period pain is more, my bleeding is more, but I didn't see anyone. So that is why I came to you. So when you scan them, this is what you classically sometimes will find, either a fibroid coming into the cavity or fibroid going down the cavity. So these will definitely increase your amount of bleeding as well as increase the amount of pain, especially the pain with the fibroids. Periods as well. So the same fibroid can sometimes come down and come out of the neck of the womb. So some people practically say, doctor, there's a ball coming down from my vagina, I can see something coming, and it's bleeding. So the bleeding, fibroids affect the amount of blood as well as the intensity of your pain. So the bleeding most classically will be regular, the same cycles you have will be increased. So your bleeding will be clotty, more like a tap, like a flooding period, and then it stops. And at the same time you can have more pain as well. In between bleeding as well is possible with the fibroids. So all these are possible. At the same time, it again depends on the size, as I said, and the number and where it is. So the same 2 centimeter fibroid that I'm talking about, if it is on the muscle of a woman, it's not going to cause much of the things that you and I are just talking. No pain, no bleeding increase, life goes on, you will not have a symptom. The same 2 centimeter moves the center of the uterus in the cavity, then you will have everything I said. So fibroids are very specific and unique in that way. So where they are, the size of them and how many are there will change everything.
Right. I have one more question, doctor, before we go into the commercial break. A very quick question. Now, you've been here for some time, for just about a year, over a year. But for the time that you've been here, especially channeling with Lanka hospitals, If you were to give me a percentage of women that would visit you, especially when we take Asia, we're taking Sri Lanka here into context, how many women have you seen coming in with this specific problem?
So again, that differs. Some will come with symptoms, which they will come and that's a question, the part of it which I couldn't answer the previous one. So you said, how will a woman know that I have fibroids? So if they come and tell me, doctor, look, my tummy is getting bigger, I'm not normal, something is not right, everyone's saying whether I'm pregnant or not. Sadly, some women will not have a single symptom. They will just come for some odd thing and I would scan them and I'll say, my God, you have a big fibroid, did you know? Then they'd say they don't. Or they come with symptom like you asked, heavy bleeding, painful period, even some come with painful sex because they feel so uncomfortable. Imagine a big melon sitting on your uterus and you're trying to have sex. So you're going to have either more pain or more discomfort as well. So you can have all these other symptoms. Some women might come and say, I just have a back pain, doctor. I have constipation. You might think, how will a fibroid cause constipation? But again, you imagine this is my uterus. And if I have a fibroid jutting and growing on the back of my womb, normally at the back of the womb you have the bowels, in front of your womb you have the bladder. So the bigger your fibroid gets or the bigger your womb size gets, it's going to press on the back. So you're going to have constipation symptoms and also severe back pain. The same happens in the front. The fibroid gets bigger and bigger, presses on your bladder. The moment you want to get up, you'll feel, oh, I want to go to the toilet. But then it's not you, it's just a fibroid pressing on your bladder, hence your frequency increases. You might want to go all the time, the urgency is always there. But as typically women always ignore, they say, this is just now, it will go away. The time that they come to me, the fibroid is much bigger. They come when they can't handle what's happening around them. So all these general symptoms, starting from back pain, simple tummy pains, discomfort, constipation, urinary symptoms, discomfort or pain during sex, all these are mixture of symptoms you might have. It's not necessarily the bleeding and the pain during periods. So if you take women, as you said, if they come to me, naturally, let's say for about 30% or 40% roughly will have some sort of a problem because of a fibroid. But I will have more women coming to me saying, I just had a scan because I had a back pain and I was told I have a fibroid, because they might be just about centimeter, but they are so worried, the word fibroid, they think I need to have a surgery, I need to have some intervention. Like that, 50% or more will come. But the true symptomatic women will always be lesser, maybe around 30 to 40%.
Right, thank you, doctor. I think on the other side we're going into a very interesting subject, as women constantly seem to deal with this, and it seems to be such a growing thing in terms of requirement of understanding and knowledge would be the pregnancy side of it. But we will do that on the other side. Do stay with us. A very interesting subject that we're talking about here, especially for the women who are viewers out there. So do stay with us. RTV MEDILINE will be back shortly.
This program is sponsored by
Lanka Hospitals. Caring, curing.
Hello, welcome back to Art Television's MEDILINE. We're here with Dr. Roshan Zeirideen Zaid, and she is a consultant obstetrician, gynecologist for Lanka Hospitals. Earlier part of the program, we were actually talking about fibroids, the causes, and basically going into a woman's menstrual cycle, her periods. Now we are going on to the next phase, which is pregnancy. And here, doctor, I'm going to ask you a two-part question. First of all, how can having a fibroid, big or small, I'm not sure, but how can having this affect one, getting pregnant, and the second thing, what if it happens during pregnancy? Like you said, once you get pregnant, there's a lot of hormone that is released, and you said the fibroid feeds on it. So before getting pregnant, if you were to have something like that, how do you diagnose it? How do you find out? And while you're pregnant, if something like this happens, what are actually, let's say, the treatments and also the risk factors? I think is very important. If you could just touch on that, doctor.
So as you said, like let's say a woman, now we passed on the normal menstrual cycles, now I'm trying for a baby, doctor, I'm not getting pregnant. Can it affect you? Yes, it can affect you very much. So again, it depends on the basic things I told you. How many you have, where are they, and what do they do? So imagine now if you are trying for a baby, there are some women who come, one of the first things we always do is do a scan to check whether there's something wrong or there's anything in the womb. So when it comes to fibroid, if I, as I mentioned to you before, if the fibroid is inside the cavity where the baby should be, so the cavity is fully covered or taken up by this fibroid, or there's a fibroid that is taking half the cavity space, or whatever it is, there's somebody new inside the cavity who shouldn't be there, where the baby should be. If this fibroid is going to grow, or if this fibroid is going to take the place of the baby, there won't be implantation, or there won't be, the baby will not be coming and settling in the endometrium or the lining of the womb, because there's already somebody there. So then your chance of falling pregnant is going to be less or delayed, because the implantation will not happen, or there won't be anything happening for fertility as such, because there's a fibroid inside the cavity. At the same time, it can increase your risk of miscarriage, because after you fall pregnant, the embryo comes down and it has to settle inside the cavity. So there is a possibility it might not happen. Even if it happens, you might end up having a miscarriage. So that will always delay your pregnancy, and that might be the cause of your subfertility. Then number 2 is the fibroids, where they are. So let's imagine the tubes, the 2 fallopian tubes are coming on either side. The fibroid that is very close to the fallopian tube. So fallopian tube, though they are tubes, the inner lumen or the inner cavity is millimeters open. So if there is even a 1 centimeter fibroid just near the fallopian tube where it comes, the tube is fully blocked. So if the tubes is fully blocked, then the sperm cannot enter the tube, neither can the egg get into the tube. So you are going to anyway face problems of tubal blockage or obstruction just because of your fibroid. So it doesn't need to be a big 5 or 6 centimeter fibroid. You can even have a 2-3 centimeter in the wrong place where the tube is coming out, will entirely block your tube out. Then you come to the bigger ones. So you can have bigger fibroids. So normally, let's say if a woman is trying for a baby and she has 1 or 2 fibroids which are about 1 or 2 centimeter, then in the muscle will not necessarily cause a bigger problem. But if they become more than 5 or 6 centimeters, 4-5 centimeters, then they are bigger. So they are multiple occupying the muscles of the womb. They themselves can reduce your chance of having a baby. So the research states if the fibroids are much bigger, 5-6 centimeters or more, removing them increases your fertility rate. So your chance of falling pregnant increases dramatically after we remove. So any woman who is trying for a baby, doesn't mean that just because you have a 1 centimeter fibroid it has to be removed. It depends where it is it blocking your tube, is it within the cavity, what else other problems, have you had miscarriages before? If they are 5 or 6 centimeters or bigger, then removing them will make a difference. If not, that doesn't mean that we just have to remove it. And the same woman, let's say the muscle of the womb, and there are about 1 or 2 centimeter, or even as I said, sesame side fibroids which we might not even see on a scan, you fall pregnant. Nothing will happen because your baby is exactly where it should be, and the baby is going to grow. But as you mentioned, the hormones in the body is going to get more and more and more. So they all feed on the hormones, and the fibroids that are existing suddenly will become bigger. So in some women what we see is as a baby grows, these fibroids will also grow. So newly appearing fibroid will come on the muscle or wherever it is, and it will start to grow as well. If the fibroids are within closer to the cavity, and they can still grow into the baby, but it doesn't directly affect baby's growth, it does not cause any abnormality or complications on the baby, but they can grow into the cavity. So if a big fibroid is going into the cavity, it can automatically change the baby's position. So you have a big room and there's a big lump in the cavity with a baby. So baby might not be the straight baby like we want, like vertically, whereas baby is ready to coming down or whatever. You can have abnormal positions of baby. So baby can completely go transverse, baby can go bum down, baby can turn anywhere because this other person is occupying the cavity. So baby will take the most comfortable position, avoiding this. So you can have abnormal positions of the baby when you are pregnant. At the same time, these lumps will grow. So when they grow to a certain size, they can again squash. So you can still have further back pain, you can still have further problems of constipation, further issues of urination on top of what you have in pregnancy, and also localized pain. The fibroids get bigger and bigger, and you can have little localized pain. So if a woman has a fibroid on the top of the womb, she might exactly tell you, doctor, here it's hurting, not anywhere else. So the localized pain will become because of degenerative, or the tissues inside the fibroid can kind of die off. So you get this red degeneration, as we call in pregnancy, where the tissues die off and you can have localized pains. So all these issues can happen when you are pregnant. On top of it, it will also can affect the mode of delivery or how you would deliver. So if the fibroid, as I said, the top of the womb, the body, and the neck of the womb, the cervix, you have a fibroid exactly sitting on the outlet where the baby is going to come. If your fibroid is here, one, it will completely close off the exit. So there is no way this baby will come out because this whole thing is blocking the pathway. So there is no way this will dilate, neither will you be able to have a normal delivery. So it might completely dictate how you would deliver your baby. Or at the time of the cesarean, for example, if your fibroid is exactly where I'm going to make my incision, then again the whole surgery will be complicated because there will be excessive bleeding, there will be problem getting out, there will be problem doing the surgery. So all these surgical complications can also happen depending on where they are and how big they are. It doesn't stop there, it goes on. So you go on to deliver. So now you have a fibroid, on top of it you had your baby is growing fine, and the time of the delivery comes. When the time of the delivery comes, the rest of the muscle is muscular, so they don't have fibrous tissue. They will readily contract as soon as a baby comes out. So as soon as a baby comes out, the placenta comes out, the whole womb will contract in order to stop the bleeding, so that you will not have excessive bleeding following delivery. But where the fibroid occupies a fibrous mass or a tissue, it cannot contract. So the rest of the muscle will contract readily, but this ball will just stay like that. So it will not, around it will not contract at all. So you have a tendency to have excessive bleeding following delivery. So fibroids, as I said, if they are tiny, even if they are 10 and you have just about a centimeter, half a centimeter, might not cause a thing for you. But the bigger they get or the number they get, where they are, can have all these effects, starting from will you fall pregnant? Once you fall pregnant, will it cause problem? Will it affect my pregnancy throughout and the time of delivery and postpartum? So every aspect of your pregnancy and falling pregnant can be affected by a fibroid.
Okay. Wow, to think that something the size of a rice grain, or even for that matter an orange, like you said, could cause so much complication to a woman is amazing. And I think the most important factor here is knowledge, because women don't have knowledge of this, and then they act upon someone's advice, like we spoke about. You know, this is socio-cultural, it's also a very traditional mindset and thoughts that they follow. Okay, my mother and my grandmother said I should do this, so I have to follow, which I think is something that we really need to break, that kind of stigma of I have to do what others ask me to do, rather than I have to do what is professionally advised and right to do. That's why I'm going into the treatment, doctor. So let's talk about two parts on this. First of all, the treatment for this, and then the second part of it is, just like anything we know, that sometimes it comes to a stage where you have no option, where treatment really doesn't come into play, and then we have to go into a surgical context. Shall we talk about both those? But I have just one additional question while you go into that. You talk about this pregnancy and fibroids, where it starts at the pregnancy, it could be the size of a rice grain, but then during, obviously we said it usurps that energy and all of that, and then it grows. During the 9-month period, if you start at the size of a rice grain, how much can it grow in the 9 months? I have a very interesting question there, just to know. I was just thinking.
It all depends. So in some women, I might just suddenly find a new fibroid growing with the baby. In some women, they will come pregnant and I will see, oh, you have a fibroid as well with the pregnancy. Some, let's say about 2 to 3 centimeter, might stay the same way throughout the pregnancy. In some, it doesn't grow that fast. In some, yeah, it might go about 50%, maybe a 4 centimeter, 5 centimeter. Some humongous growth from 3, 4 to 10 centimeter all of a sudden. I don't think I can exactly tell you what is a percentage of growth, but it all depends. Depends on their body weight, depends on their fat, depends on how much estrogen they have, depends on lots of things, and their genetic makeup, everything will depend.
So it's individual.
It's very, very individualized. I can't put a percentage and say this much it will be, but it can vary from no change at all to 100% double growth.
Right, okay. And then let's talk about the treatment, doctor, just as I said. What are the modes, methods of treatment? What should a woman's kind of wake-up call be to say, okay, wait, I'm having this, maybe I need to stop self-medicating, maybe I need to stop asking the traditions of family and friends, maybe I need to stop going on WebMD, and maybe I need to actually consult a doctor. So let's talk about that to the treatment process, that link.
So the treatment, when do you really need a treatment? So as I said, once fibroid is diagnosed, out of 100 women who have fibroids, only half or less than half will have some sort of a symptom. So again, your treatment will be very, very individualized, starting from how old you are, your fertility desires, whether you want to have a baby, no baby, how many fibroids you have, where are they, and what are they causing. So all these have to be addressed. So it has to be an individualized treatment. So I'll give you a few examples. If a 25-year-old unmarried girl comes to me with a 10 centimeter fibroid, is a different person. If I get a 45-year-old coming to me with another 5 or 6 centimeter multiple fibroids, is another thing. Another 60-year-old who comes to me with the same 5 centimeter fibroid is complete different things. So all of them can't have the same treatment, because 25-year-old will be thinking, I have to get married, I want to have a baby, I don't want to have complications. 45 might think, yeah, I've just had a few babies, I don't have any other issues, I might or might not want babies, what do I do? 50-year-old is like, I don't have periods now, I'm not interested in surgery, do something about it. So all of them will have different priorities in life, different outlook. So everybody's treatment will be different. So let's first of all think, if you needed treatment, what can you do? So treatment again depends on your symptoms, as we spoke about. So symptoms can vary from periods to baby to a lot of things. So if there are simple period issues that you have, you can still have symptomatic treatment. So a woman who has heavy bleeding, painful bleeding because of period, you can have symptomatic treatment for the pain and the bleeding. But it's not going to change your fibroid. You're only going to survive your period by taking treatment for that. If you have a fibroid that's causing you other issues, then we have to think about, what can I do? There are women who would think, no doctor, I'm not very much interested in surgery, tell me something else. So then you can either think of, how can I shrink the fibroid, or what can I do to stop it from growing. So shrinking, as I said, the fibroid will be working on hormones and blood supply. So if I can shut down the blood supply of the fibroid, it shouldn't grow. So there are methods where we do, every tissue in our body will grow with blood supply. So there are methods we can do where directly attack or block the fibroids feeding vessels. So just like we do the cardio things, the angio and all that, we thread along the vessels and get into the fibroids where the vessels are feeding. We block the vessels individually. So individual blood site, the specific fibroid is stopped. So that's called uterine artery embolization. We block it. Once you block it, they will not grow. So eventually they should shrink. They might not disappear, but they'll shrink, and your symptoms or problems might ease off. The other thing is hormones. So there are specific medications where you can give to block the receptors which will react with the hormones. Hence they will not grow. Those medications are not in Sri Lanka, but you can still get them down to treat yourself. So that is one. There are other things where still we block hormones, hormones by injections. They also work to a certain extent. So none of them will make it disappear, but they can always shrink the size. Especially women who are expecting babies and pregnancies, they are not very much keen for surgery because they know there can be complications. Hence they always say no, and these medications are specifically designed for women expecting fertility. So they can have a better fertility outcome without a surgery. So they can shrink your fibroid, hence your bleeding can reduce, hence the blockage can reduce, hence you can have a conception pregnancy and your life can be much better. So apart from these, there are newer coils. There's a coil called a Mirena. So it's ideally called an intrauterine system, IUS. It's just like a copper coil, but it's a plastic coil with hormones in it. So it can stay within the uterus and it can release some specific hormones. Hence it also has a protective effect where your bleeding can be lesser, your pain can be lesser. It might not let the fibroids grow further. So it can kind of arrest the growth and it can stay there. So again, that is for some, and also it will work as contraception. So it will again not work for everyone. As I said, it will differ from person to person. So all these are completely non-surgical. And also, maybe not in Sri Lanka, but in other countries we have ultrasound guided. You can specifically send ultrasound MRI waves to the fibroids, hence they can shrink down. So all these non-surgical methods are still there. And even the simple contraceptive pills and all these are symptomatic relief of your symptoms you might have. Hence, you can still have a wide range of non-surgical methods where the women can have some sort of a relief, or even the size can shrink, and then the symptoms will get better. If these don't work, then you move on to your surgical options. But every woman, most of the women, as you said, because they are not aware of the options available, the first thing they think is, I have to have a surgery, I'm going to have my womb removed, my fertility thing is out, I can never have a baby again. All these come into play because they all think that is the only thing. But you have to understand that is the last thing. Because in the next, even in the surgical option, if you have a fibroid inside the cavity, there are cameras that can go into your cavity and kind of shave it out and come out. So you're not going to have any scars in your body, completely natural hole. I'm going to go through the natural orifice of the cervix, go into the uterine cavity, shave it off, burn it off and come out. So your fibroid is gone, no scars at all, your bleeding is lesser, your pain is lesser, you can have a baby and life is back to normal. If there are fibroids on top of the womb or in the muscle, still you can have individualized as opposed to an open surgery. It used to be open surgery 20-30 years ago for everything. So people used to have a midline cut or a big transverse cut, like a bigger cesarean cut, and then you go in and remove fibroids. So you can, instead of doing that, you can do all of them through keyhole, where you put a scope through your belly button on 2 holes on either side, maybe a 4th, but they are all 5 to 10 millimeter. So it's half a centimeter to a centimeter hole. You go in, individually cut the fibroids, core them out from the same holes, stitch you back again, and you're back to normal. So there are so many things you can do. The last thing, so let's say either open myomectomy, which is a fibroid removal by open, or laparoscopy, or even hysteroscopy is what I said by the thing. None of them are working and you are struggling to get away what you want. Either it can be a bleeding issue, pain issue, whatever. Then the last thing will be a hysterectomy. Again, that is also, again you have to think, so if I'm going to do a hysterectomy, that means I'm going to remove your womb forever, and that itself can have other issues. Yes, we might be only thinking about fibroid, but doing a surgery has its own issue, where you can have adhesions later, you can have urinary problems later, your ovaries can suddenly stop working later, you can have all these other issues. So that should be the last thing a woman should ever think, and it is your organ. It signifies you as a woman. So that will be your last thing to do if it comes to treatment of fibroids. But our women always think that is the first thing and only thing available for her to get rid of her symptoms. So you have to understand, as you first started off, empowering women about what is out there. If you did have a fibroid, A, B, C, what do I have, what do I do? You have to have your own thing. Like what we just simply said, if they can understand all the things that are available, non-surgical, surgical, then your perspective of what is going to happen next is when you decide what you want. So it has to be an individualized, tailor-made treatment.
Okay, wonderful. Thank you, doctor. I think this is very enlightening, because this is something that every woman, whether it's a women's gathering or 2 women sitting together, this is a conversation that seems to frequently come up, whether it's the circles I know or you know or anybody out there. So I think it's been very educative, and like you said, the most important thing for a woman is first to be educated. As much as tradition and culture is good and well said, sometimes you need to do what is best for your body, especially with changing times and food and, you know, the situations that we face, as opposed to back in the day where it was a very different lifestyle and situation. So thank you very much for that. As you know, you can visit Dr. Roshan here at Lanka Hospitals. She did tell you about the best treatments that are available here at the hospital as well, and Dr. Roshan would be more than happy to see anybody. I don't think it's just related to fibroids, but anything related to the obstetrician side or the gynecological side, you can meet Dr. Roshan and you can speak to her. Thank you, doctor, for your time. It's been an absolute pleasure speaking to you. And ladies and gentlemen, we do hope you enjoyed this program of MEDILINE. More to come with more interesting subject matters related to your health. Keeping your health at heart, we wish you all a pleasant evening.
Lanka Hospitals. Caring, curing.